Hi everybody, this is Dr. Sham. I'm a rheumatologist. I practice in Chennai. So the first step is pain relief. In yesterday's video or the previous video, you saw how initially we try to relieve. See, at the end of the day, our doctor's job is to ease the patient's pain and suffering. So that's what we do initially. But as I told, it's a temporary measure. The main thing is going to be these drugs. These are called as disease-modifying agents. The most common drug we use is a weekly drug called methotrexate. Then we have other drugs called leflunomide, sulfasalazine, hydroxychloroquine. Igritimod has been recently added, used in parts of Asia, though not throughout worldwide. So usually it is the first 4 drugs which we use commonly. See, remember, any drug which goes into the body or into the system, which has a good effect, there is a risk of having a side effect. Please, I'm again underlining it. Risk of having a side effect is not equal to always having a side effect. If we walk on the floor, there is a risk that we might trip and fall. The same thing. So each drug, if you ask whether I can get a side effect, the answer will be yes. So it shouldn't be that. You have to ask, what are the common side effects? What are the less common? What are the least common? So you have to ask your doctor, I'm starting this tablet. So what are the something, if any unusual symptoms I experience, when should I report to you? So that is how the conversation should. So always discuss with your doctor, ask what will be the common side effects. So your doctor will be, see, it's not, side effects are not the same for all the tablets. So your doctor will be able to definitely tell these are the common side effects for tablet A, for tablet B. Similarly, as I told, to be careful, or like how we drive safely. Again, this is a common example I tell my patients. You wear a helmet, people ask you to wear a seat belt if it's a car. Similarly, to drive safely, particularly if you are a rheumatoid patient, always keep doing the blood investigations regularly. For example, if it is going to be something like a methotrexate, leflunomide, we do tests like blood counts, liver function test. None of these tablets go through the kidney. There is another thing. Many times people think if you take this one like an allopathic drug, definitely it will cause. It's not like that. It's not that all the tablets will cause a kidney damage. Each tablet has its own risk profile. So, for example, these 2 tablets, we have to be looking for the liver functions. If it is it's a not so, this one, we have to just keep looking for the counts. It never goes through the kidney or liver. If, for example, hydroxychloroquine, many of you might be heard of because it became famous with this recent COVID. So this is something, it never touches any organ, but if a patient is going to take regularly, we have to do periodical eye checkup. So each tablet has its own nature, has its own risk profile. So that has to be discussed with the doctor. To travel safely without side effect, only thing is monitoring. Again, some people ask, doctor, every time I'm doing the blood test, but it's normal only. Like, we should be happy it's normal, because as I told, side effects are not going to be seen in all the patient. It's going to be seen maybe in 100, it's going to be seen in maybe 5 to 10 in general. I'm telling, not with regard to any drugs, just for example. So I also don't know among the 100 who is going to be that 5 to 10. You also don't know. So best thing is to keep monitoring. Every time my patients, I see the blood test, only if it is normal, then they will be asked to continue the tablet for the next 3 to 4 months. So usually as per recommendation is 2 months, it might be 2 this one close. So in practice, we do it once in 3 to 4 months. That will be a safer option. Some patients who are doing very well or on milder drugs like sulfasalazine, hydroxychloroquine, even once in 6 months should be fine. So in blood test, we look is for side effects. Other thing we also see is how is the disease activity. We do check the TSR, CRP to see how is the disease activity is whether controlled or not. So the second step is the most crucial step. So these are the common drugs. Majority of the patients, 60 to 70% of the patients, if we are going to identify early and treat with these common drugs, the patients do very well. Thank you.